Well, good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in Peel, Darren Rizzi, our Fire Chief and our Director of Emergency Management, and this week, a very special guest, our former Mayor, the legend, Hazel McCallion, is with us. Before I give my COVID update, I want to first wish everyone a very happy St. Patrick's Day. St. Patrick's Day is an opportunity for all of us to celebrate the heritage, culture, and contributions that Irish Canadians have made to Mississauga and to all communities right across Canada. Irish Canadians have helped build some of our oldest and most cherished neighbourhoods, and their culture is weaved right into the fabric of this city. Like a lot of you, I'm disappointed that we can't go out and celebrate as we usually do. I always love to go out and grab a green pint with friends after work. But I want to thank everyone for celebrating responsibly this year. It's what we have to do to keep the virus at bay. To mark St. Patrick's Day, we'll be lighting our clock tower green this evening. So I asked Hazel McCallion to join me here today because she was vaccinated a few weeks ago at Trillium Health Partners. And I know that there are some residents who are a little bit nervous about getting the vaccine. And I thought, who better to inspire them than the living legend herself, but Hazel McCallion. Hazel has always led by example through her entire life, and she's done it yet again by getting the vaccine at 100 years of age. So Hazel, why don't you come up and say a few words about your experience getting the vaccine and why you feel it's so important for everyone to do so. Hazel.
Thank you very much, Madam Mayor, for inviting me to be with you today. I want you to know that I listened very carefully to you and our Medical Officer of Health. You're both doing a great job of keeping the Mississauga people well informed as to what they should be doing and the status of the situation in the city. So thank you. Well, I just want to tell people that I was vaccinated. You know, I was sitting at home for so many weeks hoping, when are they going to call? Because I want to be vaccinated. It is so important. And finally the call came and I went down to the Trillium Hospital. No problem, just walked in and they were it was well managed. Everybody was apart, separated, but they got to the area where to be vaccinated. No problem at all. I've had no reaction, but I feel so much better because I've been vaccinated. Vaccinated to protect myself, vaccinated to protect my family, vaccinated to protect my friends and add to the community. So, ladies and gentlemen and young people, please take advantage of the opportunity to be vaccinated. Because if you care about yourself, and you hope you will continue to be well, if you care about your family, if you care about your friends, and if you care about the community, you will make an effort to get vaccinated. It is so simple. I had no reaction, and I feel so good about it. And you will feel good about it too. So thank you, Madam Mayor, for the opportunity to encourage people to take advantage of every opportunity you can get to be vaccinated. It protects you, your family, and the community. Thank you, Madam Mayor, for the opportunity to tell people how important it is.
Wow, well, thank you, Hazel. I really hope that hearing from Hazel inspires other seniors, in fact, everyone in our community, to go out and get vaccinated when it's their turn. It really is the safest way to protect yourself and all of those whom you love. Thank you, Hazel. Right now, people 80 and older are eligible to get the vaccine. And our hospital partners are very busy booking appointments and getting shots into people's arms. To date, Peel Region has administered close to 80,000 vaccines. The province launched their online booking system on Monday, but here in Mississauga, the groups eligible for the vaccine, which includes adults 80 and over, Indigenous residents, and healthcare workers, have been booking directly through our hospital partners and with Peel Public Health. The best way to book an appointment is by visiting peelregion.ca/coronavirus/vaccine. There you will find all the information you need to book a vaccine appointment. Again, I encourage everyone to get vaccinated once they are eligible. If Hazel has the confidence to do so at 100 years of age, everyone should. If you don't have internet access or are having trouble booking online, you can call the region's vaccine line for assistance, and that number is 905-791-5202. The lines are open from 8 a.m. to 8 p.m. 7 days a week. 8 of our primary care clinics have also been contacting eligible residents aged 60 to 64 to get vaccinated through our primary care pilot project with the AstraZeneca vaccine. I think it's safe to say that the vaccine rollout in Canada and across the province has required a lot of patience from everyone. I know a lot of you have seen the reports that in the U.S. that they are on track to vaccinate all adults by the end of May. And countries like Israel and Chile are vaccinating huge numbers every day. It has been slower here, and like many of you, I know you are frustrated. I'm very encouraged, however, that starting next week, the vaccine rollout will ramp up significantly. Canada is expected to receive 1 million doses every week from March 22nd to May 10th. And next week, Mississauga and Peel will receive the largest allocation to date and will be able to further increase appointments for our priority groups. This is promising news, especially because Peel has been one of the hardest hit regions in the entire country. Along with Toronto, we have been in lockdown longer than any other jurisdiction in North America. I know many people were disappointed that Mississauga was not included in the pharmacy pilot project that saw other regions in the province receive the vast majority of AstraZeneca doses that were allotted to Ontario. We saw regions like Windsor-Essex and Kingston, Frontenac, Lennox, and Addington receive huge shipments, yet both regions are not even in lockdown. In fact, Kingston is in the green zone right now. I personally do not think this is fair. But I can tell you one thing for certain. I am unwavering in my commitment to ensuring Mississauga receives its fair share of vaccines. I am urging the province that Mississauga and all of Peel receive vaccines proportional to our need and that we are included in any future pilot project that will result in regions getting additional doses. Last week at Regional Council, we passed a motion that asked the provincial government to immediately include Peel in the pharmacy pilot project. We also passed another motion urging the province to prioritize our 300,000 vulnerable workers who work in our warehouses, manufacturing centres, food processing, packaging, and distribution facilities. Our essential workers in Peel have been critical in keeping the economy of this province and really in the entire country up and running throughout the pandemic. And they continue to shoulder a disproportionate amount of risk as we have seen so many outbreaks in essential workplaces. Getting our essential workers the vaccine as soon as possible is not just the fair thing to do, it's the best thing that we can do to limit community transmission and to get out of lockdown and to begin to see the broader recovery and reopening of our economy. I will do whatever it takes to make sure that Mississauga gets our fair share. The reality is that we've done everything we can at Council to get ready for the rollout. All 5 of our mass immunization centres are now fully operational, ready to get shots in arms. We have the capacity to do more than 20,000 vaccinations per day here in Peel. So we have done our part. Now we need the supply from our federal and our provincial partners and counterparts. We need more vaccines here in Peel. We're truly in a race against the variants of concern. All across the province, case counts are rising again, and hospitals are being pushed to their limits. In Peel, we are now averaging 107 cases per 100,000, and that is up from 88 cases per 100,000 from last week. In Mississauga, we are at 78 cases per 100,000, and that is up from 63 last week. The R factor, the most significant number, the most significant indicator of community transmission, is once again above 1. That means that for every person who catches COVID, they will give it to at least one other person, increasing the threat of exponential growth. These are troubling trends, and certainly not what any of us want to see. For several weeks, I have been advocating for Mississauga to move into the red zone to allow for more businesses to open. But with the rapid rise in case counts, it's not going to happen this week. I'm disappointed, like many of you, but we have to do everything in our power to limit the impact of the virus, and now it looks like we are approaching the third wave. Like other hospitals across the province, Trillium and William Osler are seeing increases in the number of patients with the more transmissible B117 variant first reported in the UK. We are also seeing cases of the B1351 variant first reported in South Africa and the P1 variant first reported in Brazil. Trillium is currently dealing with 50 COVID hospitalizations, 14 patients in the ICU, and 83 suspected cases. Brampton's William Osler currently has 60 COVID hospitalizations, 6 patients in the ICU, and 40 more suspected cases. There are currently 8 long-term care homes, 5 retirement homes, and 8 group homes or assisted living facilities in active outbreak in Peel. I am hopeful that with more vaccines arriving, we'll be able to limit the impact of the third wave. But everyone needs to, once again, buckle down. We're getting much closer to putting this nightmare in our rearview mirror, but the next few weeks are going to be critical. Please continue to follow the advice of public health. I'm also very aware of the toll that the lockdown has taken on our residents, but especially on our small business owners. Today is the 1-year mark since Premier Ford declared a state of emergency in Ontario. It is really hard to believe that it has been 1 full year of this. And I know just how tired people are and how this has affected so many people's physical, mental, and financial health. The Peel mayors have talked to Dr. Lowe about this extensively. And I'm happy that Dr. Lowe is now in discussion with the province on how we can start to see some loosening of restrictions, even as we remain in the gray zone. Earlier in the week, we discussed the potential of restaurants perhaps opening for outdoor dining. We also discussed the possibility of fitness clubs and dance studios being permitted to hold outdoor classes and potentially opening up some of our outdoor recreational facilities to allow for sports teams to train and to practice. Dr. Lowe has told us that if people stick to the safety protocols, he believes that the risk of these activities can be managed. And he has assured us this week that he will be bringing forward these recommendations to Ontario's Chief Medical Officer of Health, Dr. Williams. I'm calling on the province to recognize the sacrifices that our residents have made and allow for lower risk activities. Please. Our residents and businesses have been asked to sacrifice so much, and their extraordinary efforts need to be rewarded, even if it's something small like being able to go outside for a fitness class, or grabbing a drink or a bite to eat on a patio at one of our restaurants. Protecting our community from COVID remains a top priority, but we also need to find a way to allow people to do the things that are vital to mental health and overall well-being. I will provide an update on this later in the week when Dr. Lowe hears back from his counterparts at the province. Please, Mississauga, stay safe and stay well. And now I will invite Dr. Lowe up to give his remarks.
Thank you, Madam Mayor, and good afternoon. Thank you, Mayor Emeritus McCallum, for your kind remarks and sharing your vaccination story and being with us today. Mississauga's test positivity for COVID-19 currently sits at 4.9%, which is up from 4.4% last week, and its weekly incidence rate is at 78.1 cases per 100,000, which is up from 63.2 per 100,000 last week. Today marks a year since the first declaration of a provincial state of emergency, and we continue to respond to the COVID-19 pandemic that has unfolded in our community. Current trends in Peel and Mississauga remain turbulent, and the race between variants and vaccines continues to be separated by a hair. We are starting to see that vaccine variants are more transmissible, and our data suggest that they may result possibly in more severe illness, requiring earlier hospitalization and longer intensive care unit stays. On the other side, however, I am hopeful as we see vaccine allocations start to increase, as was anticipated by the originally released delivery schedules provided by the federal government in December. Help is at hand, but we all need to continue lending a helping hand. I urge everyone to stay kind, certainly, no matter how frustrated or fatigued we may be of the pandemic in this late phase. I also urge everyone to stay at home as much as possible, to continue meeting for essential reasons only, wearing a mask, keeping your distance, and washing your hands, and certainly, if you're sick, to get tested and self-isolate. The same core 4 behaviors work against the variants. They will keep us all safe as more and more of us are given protection in the form of vaccination. On the topic of vaccination, we continue to vaccinate our seniors over 80 plus at our hospital sites and our very high priority healthcare workers as defined in the province's framework, and this week have also started opening appointments to Indigenous adults. Because we have so many people who live in our region, we continue to get vaccine out as quickly as we can get it, but moving through the priority list is taking time. If you are eligible, please visit peelregion.ca/coronavirus/vaccine to be directed to our local booking sites and also to check your eligibility as it's regularly updated. You can also call 905-791-5202. I'll say that again, 905-791-5202 from 8 a.m. till 8 p.m. 7 days a week if you need help booking online. Please know that all sites in Peel Region are now also abiding by the new provincial directive to move second doses out to 16 weeks. The data that has been reviewed by our federal counterparts suggests that 1 dose provides significant protection and allows for many more of our residents to access protection sooner. Thank you to everyone for your patience and for looking out for your fellow residents, and also for being kind with our frontline workers who might be calling to rebook your appointments. We are all working with limited supplies and trying to get what we have out as quickly as possible to those who are at the greatest risk in our community. In the next few weeks, I am hopeful that many of the current issues of supply with the vaccine rollout will be resolved, and we in Peel stand ready with our hospital partners to get more and more doses out quickly. We're almost there, but like a marathon, the last miles are the hardest miles, requiring dedication, perseverance, and sacrifice. Staying focused is the difference between finishing the race or crashing out before the end. And we cannot let up now as we are so close. I'm also hopeful that in the coming weeks, we may explore some opportunities to make the most of better weather and our outdoor spaces in coming out of what has been a long, difficult winter But in the meantime, I'm asking each of you to continue doing your part. Let's keep this under control so that we can focus on vaccinating instead of dealing with a third wave, so that we can save lives and protect our most vulnerable, keep our schools safe and open, and get back to business sooner rather than later with the confidence that COVID-19 is firmly behind us. My thanks, and I will pass it back to Mayor Crombie.
Thank you, Dr. Lowe, as always. Thank you to Hazel McCallion, as always. And we are all now prepared to take your questions. I'm sure you may even have a few for Hazel McCallion.
Your first question comes from Jamie Gutfreund from CP24. Go ahead, Jamie.
Thank you very much. My question is for Dr. Lowe. You've talked a couple times today about some of the turbulent trends that you're seeing in Brampton, especially when it comes to the variants of concern, but you've stopped short of calling it a third wave. I'm just curious, what criteria would the data have to meet for you to say officially that Peel and or the province is officially in a third wave?
Thanks, Jamie, for the question. I wouldn't speak for the province. That would be Dr. David Williams, our Chief Medical Officer of Health. For us in Peel, we look, as you know, on things on a 2-week trend. 2 weeks ago, we saw a declining trend, and this week we see an upward trend. There is an uptick. Whether it is sustained in the manner of a wave is something that we will only know through this week, but certainly something that we are monitoring with concern and really speaking to the tone of caution that I have signaled here in trying to balance the variants, the vaccines, the better weather, and how we continue to keep people's mental health and well-being in line, optimal as we move towards broader community vaccination. Thanks for the question.
Dr. Lowe, my follow-up question is for you as well. We're hearing, this is on behalf of one of my colleagues, we're hearing from a source that there was a meeting today with Dr. Williams' team, Peel Public Health Ontario, Dufferin Peel Catholic School Board, Peel District School Board, and the Ministry of Education. And what we're hearing from our source is that both Peel school boards requested at this meeting to move to remote learning from now until April 19th, and that during the meeting they cited the increase in cases in schools in Peel region, increase in teachers' isolation, and not being able to safely keep the schools open. The Ministry of Education denied the request because Minister Lecce isn't supportive of moving these schools to remote, and said that the public health units should be making this decision and not the school boards or Ministry of Education. Can you confirm that Peel school boards are requesting to move to remote learning until April 19th?
So I can confirm that we are in close contact with our school boards. Certainly, there have been questions raised around the ongoing picture of transmission in our community. At this time, of course, we continue in discussions with our school boards, and ultimately will issue recommendations that will continue to keep our community and our school system safe. But yeah, I think that's about all I can say at this point in time. Thanks for the question.
Next question.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Hi, Mayor Crombie. How are you?
Welcome, Ashley. Thank you. Thank you for joining us again.
Thank you. So I wanted to ask about vaccines as well. I know you mentioned that Peel's going to get a bigger allotment next week, which is great. But I know a few weeks ago, I believe it was Councillor Parrish who said that Peel should consider sourcing its own vaccines, which I know is something that's uncommon, but I believe Manitoba has done it. So with Peel not being included in the pharmacy program and, potentially not getting the huge blitz that it would desperately need to escape lockdown and protect the healthcare system, I'm not sure if maybe Dr. Lowe would want to weigh on this as well, but is this something that the region is considering, and is it something that the region can actually do should you not get adequate supply from the province in the days and weeks ahead?
I am going to ask Dr. Lowe to respond to you, Ashley, but I believe it is not within our ability, our power, our jurisdiction to make separate or to negotiate separately with companies related to vaccine allocations. So I'll ask him to clarify. And meanwhile, let me tell you as well that I'm very concerned about the flow and the allotment of vaccine to Mississauga and to Peel in general. When there's a house fire, you don't need to pour water on the houses all around it. You need to pour report directly on the source. And so this is a plea to the province and to the Premier to please include us in additional doses. We are a hotspot. The only way we're going to get past this virus, in fact, is if we give a greater share to those regions that need it, and we need it now, and we should be part of that pharmacy pilot, so please. So Dr. Lowe, do we have the ability to source vaccine ourselves? And I don't believe so, but go ahead.
Yeah, thank you, Madam Mayor. Thanks, Ashley, for the question. I can confirm that I believe Mayor Crombie's interpretation is correct, and certainly we do know that there have been provinces that have actually tried to source vaccines themselves, but were advised that due to contractual obligations with the federal government and the federal government's role in procurement, that would not be a facility that would be available to them. Thanks for the question.
Follow-up?
Thank you.
Thank you.
And so I know that it's still a bit early because we're still in March, but it will be cherry blossom season soon. And I know that right now there's been some reports about how Toronto might still do a virtual cherry blossom viewing this year instead of allowing crowds in Hyde Park. But given what we know about outdoor transmission being significantly less risky, and with Peel pushing for a modified gray zone with less restrictions on outdoor activity. It might be early to say, but do you think that Korea Park could be open for in-person visits this spring, maybe with extra safety measures such as like timed entry or something like that?
You know, Ashley, it's a great question whether we do it by webcam again this year, but it's such a shame because, of course, it is an outdoor activity, and maybe we can monitor the safe entrance and the capacity flow of people passing through. I would love everyone to experience them if they haven't. So this is a discussion we've yet to have, but perhaps there are some other options. We closed it down last year because, of course, we were in the middle of the first wave and everything was very new to us, but perhaps there is a way to manage the crowds, maybe booking an appointment, reservation, whatever it might take. Otherwise, of course, they will be up on the webcam. Actually, just with respect to your other question, I was thinking about it while Dr. Lowe was speaking, and I really would like to do an analysis, a deeper dive on the allotment of vaccine that Peel has received in comparison to other regions and other public health units, because I really truly believe that you have to deal with it at the source. And if we have the highest density here, then and the spread, of course, the risk of transmission is so much greater in Peel region and in Toronto, then it only makes common sense that we get a greater allotment of the vaccine. Thank you. Next question.
The next two questions are for Dr. Lowe. They're
Perfect.
from Isaac. They're from Isaac Callan at the Pointer.
Perfect. Welcome,
ahead,
Isaac.
Thanks,
Hi,
Isaac.
Hello, how are you?
Good, how are you?
I'm good, thanks. I want to pick you up on the definition of the third wave and just push for a few specifics. So you said that it's, about the 2 weeks trend, which I understand. Is that purely in terms of case numbers, or is that cases per 100,000? And if there are specific criteria and indices that you use to make that decision on when the next wave is, could you please really lay them out for me?
Yeah, thanks very much, Isaac. As we've talked about, with regards to second waves, third waves, et cetera, there are a number of metrics that are there. Certainly the cases overall, 7-day moving average, the overall trend, cases per 100,000, test positivity, and also, of course, working through the nature of spread and where spread is coming from, as whether it's contained in known clusters or elsewhere. That was why you and I have had numerous differences as to the declaration of the second wave, but as you know, we were seeing steady, consistent rates, steady, consistent case counts through September, and it was and contained within certain clusters. That then moved to broader community transmission, and then of course that significant increase that we saw after Thanksgiving, October, which is why I, as an epidemiologist, would say that was when our second wave started. So for the same reason, we have a trend where there was an increase. There was a decrease the week before in terms of our cases per 100,000, an increase after. You'll see the 7-day moving average similarly reflects that. Of course, we have broader community transmission at this point in time, so that's not necessarily a factor, and we are monitoring test positivity. But if we start to see a sustained increase, especially over the next week or two, then I think it will be very clear that we are starting to see a dreaded third wave, which hopefully we can mitigate. I hope that helps explain things for you.
Follow-up?
Yeah, thank you. That was really helpful, thanks. My follow-up is about, vaccines. I think it's very interesting that Mayor Crombie says she wants to see an analysis or a deep dive, because we asked last week to Appeal Public Health for the number of AstraZeneca doses that you would be receiving as part of the primary care pilot. And we were told basically you can't tell us the number of doses because they're ever changing. And then it emerged on Tuesday that Councillor Parish had been aware of the number of doses. She's mentioned at a press conference. And I went to confirm that with Peel Public Health. Again, we were told that we can't share the number of doses because they're ever changing. So I just want to know why there's not been extra effort to share exactly the number of doses that are coming into Peel and then going out into arms to provide that transparency for people, so we know if Peel is getting its fair share of vaccines or not.
Isaac, there was a ministry directive up until just recently that prohibited us from sharing this information. The ministry has advised that the directive is lifted, and as you know, with the directive being lifted, our team is actually preparing communications products and website updates that will answer that question. Thanks very much.
Isaac, it's Mayor Crombie. I just wanted to say that I'm hopeful we're not below the provincial average, and we will do the analysis so we can be assured that we receive our fair allotment, particularly given that we're a hot zone and hot zones need to be addressed.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm very well, Steve. Thanks for joining us today.
Thanks for having me. My questions are actually for Dr. Lowe.
Sure, no problem. He's popular today. And nobody's asked Hazel anything. That surprises me.
Thank you, Madam Mayor. Go ahead, Steve.
Hi, Dr. Lowe. Just a question around the National Advisory Committee on Immunization saying this week that AstraZeneca, the eligibility was going to be higher than 65. Does that impact Peel's plans in the short term, or can residents older than 65 expect in the near future a dose of AstraZeneca under the new rules?
Yeah, thanks, Steve, for the question. Of course, the directives are being set by the ministry, and so certainly we will abide. At this point in time, because of the previous NACI guidance, it was set for 65 and under, and so the ministry has indicated that it is available 60 to 64 in certain pharmacies, in certain communities, and in certain primary care settings in certain communities, including here in the region of Peel. And so to the extent that that is that's what we're trying to, that's what we're managing, we will take our direction from the ministry. Thanks for the question.
Follow-up?
My follow-up is for you, Dr. Lowe, as well.
All right, go ahead, Steve.
I was just wondering, kind of building off of Isaac's question, Mayor Crombie's mentioned that there's a much larger allotment than previously received coming across to Canada for vaccines. Can you tell us what your anticipations are for what Peel would be receiving from that new allotment? And just one question I'll tack on here for former Mayor Hazel McCallion. Can she tell us what vaccine she selected and also when her second dose to be scheduled?
So what I'll do is I'll answer the question around allotment. The numbers are constantly changing, and so we are obviously in talks with our ministry partners to ensure that we obtain whatever allotment we are able to obtain. However, I will also say in terms of which vaccine, the recommendation is any coronavirus vaccine is a good vaccine. The percentages are not head-to-head comparisons. They are comparisons of that vaccine to nothing, to placebo. And so all vaccines approved by Health Canada are safe and effective for the purposes of preventing coronavirus disease. And I would encourage anyone who's eligible, if you are provided a vaccine, please take it. It means one more person who has protection. It brings us one step closer more quickly to the end of this through community immunity. So I don't know if I'll pass it to Mayor Emeritus at this point. Thanks.
Hazel? Hazel? They want to know. They want to know which vaccine you took and when is your second appointment. Which vaccine?
The vaccine I took was the first Piper, and I had no reaction. And I feel much better about it. I feel good about it. In fact, I was looking forward to the call to go down to the hospital to get the vaccination. I feel better about it. My family feels better about it. Unfortunately, they're not vaccinated, but they know that Mom is and that I'm safe. And it's a protection for those, for my family that comes to visit me, that I have been vaccinated.
I
So,
want to know when your second appointment is.
pardon?
Second appointment. The second?
Oh, my second shot is April the 9th. And Michelle DeManuel, the president of the hospital, said that the first shot protects you. But it isn't until you get the second shot that you have the full protection. But there is protection with the first shot, and I think that's important for people to know that. I didn't know that. I thought that you had to get 2 before you were protected, but no, it isn't. The first shot helps, but the second shot is the one that does the job. So please don't hesitate to be vaccinated. It makes you feel good and makes you don't mind being around your family, and if your friends do come to visit you, you know that they're safe, you're safe at least. So please don't turn down vaccination when it comes your turn, because it's all well managed as to the age grouping, etc. So.
Steve, it's Mayor Crombie. Just to confirm that Hazel McCallion received the Pfizer vaccine and received it at Trillium Health Partners at the hospital. And I think it was April 9th is her second shot. And Steve?
Oh, I'll get Steve back on the line. But
Oh, did he hear?
Yeah, I am here.
Steve,
I heard
Did you?
thing.
Yeah, okay. I wasn't sure if it was clear that it was the Pfizer. And once again, I do feel it is the moral and the ethical thing to do to get those hotspot regions their share of allotment of vaccine so that we can get through this quicker.
that concludes our press conference for today. We don't have any more questions. Thank you for everyone who joined, and we'll see you next week.
Thank you.